Well, welcome everyone. Thank you for joining our HR Power Hour today. We are going to be talking through navigating benefits open enrollment during a pandemic. A couple of housekeeping items. If you have any questions, please feel free to put it into the Q&A or the chat section of the Zoom call. You can ask throughout the presentation. We'll try to get to your question, or we can get to it at the very end. Our presenters today are Sarah Skowronski, our principal consultant, and Suzanne Crest, our HR consultant with Eos. I'll turn it over to Sarah and Suzanne.
So thank you for joining us, everyone. As Jenny said, my name is Sarah Skowronski. I'm the principal consultant at Eos HR. And we work mainly with small businesses, helping them to manage the HR function and all of that entails. And one of the big things right now is open enrollment. This is kind of that time of year. For smaller companies, sometimes it comes at different times of year, but this is the big push. And so we wanted to make sure we addressed this for our clients. And oh, look, we have our
Saved by the bell.
Woo! So yes, so today we're talking about navigating benefits during open enrollment. All right, Suzanne, why don't you?
Oh, that's me.
That's you.
Oh, I'm bigger than you. That was not on purpose. So I'm Suzanne. I've been in HR for, I don't know, a little over 15 years, and I've done open enrollment many times unsuccessfully, but I've learned a lot, and hopefully we can share what we know with you guys so that it makes it easier for you this year, and also taking into consideration the state of the union. So our overall agenda today will be talking about trends that you should consider during open enrollment. We're going to talk about a virtual benefits fair, give you some tips, and then just kind of summarize. Please, again, feel free to ask questions at any time, and we can be as we will try to answer your questions either at the end or, if we can, during the presentation. So first and foremost, we need to consider the fact that right now there's a pandemic in our country, and it must be considered when you're thinking about open enrollment and your benefits for next year. And we'll kind of talk a little bit more in detail, but the bottom line is employees are going to want to know if they're well, if they're safe, if they are covered, and we'll go through each of those things, but that's what you want to prioritize, not so much, oh my gosh, we have to do this new benefit. This is about making sure that your employees feel as secure as possible in a very unsecure situation.
And just to kind of add to that, I think a lot of the clients that I'm seeing going through open enrollment, the things that they're looking at is not making changes, is staying with the status quo and making sure that they've got the capability to just maintain those benefits. And if they're adding anything, it is specifically around how to support remote workers, how to support people who are dealing with COVID, dealing with homeschooling, dealing with different things that we weren't even considering, wasn't even in our scope when we were going through open enrollment last year.
Yeah, and that's very rare, but if you think about it, think about the amount of change that we have had, that we are about to have, and this is just going to add more. So if you can hold off on something that isn't 100% beneficial, then I would hold off.
Yep.
So what we wanted to remind you is that many of our clients are still hiring employees, and it is important for you to offer benefits of some kind to your employees. So right now, from what I could read online and research, less than half of small businesses offer any benefits at all. And even those that do, 81% of them only offer one policy, meaning one healthcare policy. So if you offer benefits and you offer two policies, you're already way ahead of the game. So you want to make sure that when you're looking for candidates, it's sometimes I'll be doing an interview with someone and they won't even mention it, but you want to mention it and say, oh, and just so you know, we offer benefits and here's what we offer. You want to make that a selling point right now. So a study by the Global Benefits it's called Global Benefits Attitude Survey. They've done this survey before, Willis Towers and Watson. So they surveyed 8,000 US workers. This is the end of last year. So this is pre-COVID. 37% said they would rather receive better benefits than more money. Some people that I would tell this to would not believe me. I know people who are dead set on employees are motivated by money. But this is proof that people are looking at the bigger picture. So if it was 37% at the end of last year, it's probably closer to 50 right now.
Right.
And at the end of last year, 42% said they would sacrifice pay for a more expansive health plan. And so when they did this study in 2013, 27% said they would sacrifice additional pay. So that's a pretty huge increase from 2013 to the end of 2019.
And I think part of that has to do with it, 2013 and 2013, 2012, that's when ACA came into effect. And that's really when employees started to see what the true cost of benefits were, because they were being asked to take on a bigger share of what that was. And it is expensive. It is very expensive for the employer to cover, and the employer has to cover a certain amount, but it doesn't include dependents. And that's where a lot of people are looking for additional support and additional compensation, is to be able to cover their dependents, because that can be very expensive, because we don't have the whole group, pay for a family. You have to pay for each individual person now in small group plans.
Yeah, and I've been really impressed with our, back to setting yourself apart. Our clients make every effort pretty much across the board to subsidize the cost in some way. And that's an even bigger benefit. You've gone another step beyond. So I think that's great. And if you can continue to do that, great. But I also know that you've got other financial things happening that you have to consider. But in this example, if you went to people and said, I can't afford to pay for your benefits anymore, then the chances of them leaving are pretty high. I mean, that's based on what I've read, that's what I feel. And so then you're saving money, but you don't have any good employees anymore.
Right.
So I think it's hard to balance, but I think, if you can try to keep status quo right now of what you are contributing to folks and their premiums, that would be great. And then 57% said their benefits package is more important than ever before. Again, if that's 57% at the end of last year, if I were to ask those same 8,000 right now, I mean, it's got to be higher than that, because they just want security.
Right.
So if I'm an employee, I am. Let's pretend I'm your employee. So, I mean, you've got to know, people want to know if they're covered, if they get COVID. And one of the, I was reading an article, and this quote from that article is, people are worried about getting sick or know someone who has gotten sick, and they're thinking, would I be covered for the medical bills if I have to go into the hospital or get a test?
Yeah, and being able to have that insurance and being able to know what that covers in terms of COVID is so important to peace of mind. I mean, that was, I think, and because it's so fluid and so gray, everything with COVID this year has been gray. It's like, is this covered? Is it not covered? The rules are changing or being redefined as we go. But the one thing that they've kept pretty constant is that employee, that if you have insurance, if you already have insurance, then COVID is considered one of those things that are that's covered at no expense. And I think that's important for employees to understand, because they don't, you don't want to think about it until you have to, which is when you suddenly don't feel well, and then all of a sudden you don't feel well, and you want to know that you're not also going to have to pay enormous bills on top of that, or your child doesn't feel well, or your spouse doesn't feel well. And when you're already stressed out and worried, you don't want to add to that with additional costs.
Yeah, so you definitely want to confirm that with your healthcare provider. And we'll talk about virtual benefit fair in a minute, but you can even have them be the ones to tell your employees, hey, this is Kaiser and this is what we cover. That might also help to just kind of alleviate some of their anxiety. And one of the reasons we're talking about this is just a very simple AFLAC survey, but 1 in 3 people that they asked really don't know if their benefits are going to protect them if they get COVID. So your folks are going to want to know. Even if they don't ask, I would put this as part, or make this part of open enrollment somehow. And also, people might be more interested in the details of the benefits than they have been before because of COVID. So in another survey, they said about 1/2 of the people they surveyed think that they're going to make changes. Because normally they just kind of cruise through benefits. Open enrollment's not everybody's favorite, but this year they're going to pay a little bit more attention, I would assume.
Yeah, they want to know what is covered, and if there is a richer plan that can help them, basically.
Yes.
So.
And so make sure if you do offer more than one plan, if one is different coverage for COVID than another, you have to be ready with that information.
Yeah, make sure that that's clear. So the next thing is looking, when at the beginning we talked about not making any changes to your plans, and that's really to the big plans. You don't want to make any massive changes so that it's even more confusing for people. But you might want to look at some of your ancillary plans and some of your voluntary plans, or different programs that you're offering as an additional benefit to the employees, and make sure that those are things that are still relevant. If you had access to a gym membership, or you had access to some special coffee deal, or some special restaurant deal, or something that doesn't make sense now that people are working from home, you may want to rethink that. And how can you reevaluate? How can you change that? Maybe you set up something that's virtual. Maybe you set up a virtual trainer for everybody, or maybe you set up a DoorDash once a week for people. Something that is a little different, but still is a benefit to the employees, and making sure that you're not dumping money into something that nobody is taking advantage of, because it's not a viable benefit any longer.
Oh, and this can even extend all the way to commuter benefits. If folks are working from home for a long time and they're used to having the benefit of, being able to get on BART and go to work in downtown San Francisco and have a gym on site, they're losing those 2 benefits essentially.
Right.
And so it's not really even adding benefits, it's kind of replacing them to make sure employees don't feel like their benefits have been taken away.
Right. And speaking of commuting benefits, you also want to make sure that the benefits that you are offering, that people have adjusted them in this time, so that they're not accumulating more money that they can't use. So in the case of commuter benefits, if people are still having that money taken out of their check and they're not actually commuting, they have to use that money in a certain amount of time, and they can only use so much per month. And so if people are not using that money, now that money is sitting there, and they can't necessarily get it back until they use it for commuter benefits. So taking a look at any of your voluntary benefits, anything that has a contribution that's coming out of the employee's check, and communicating to the employees that they probably want to make a change with that.
Yes. And I think by now, most of us have health plans that offer telemedicine. Granted, it became 10 times more important than it used to be. I mean, I used to, when it first came out, I used to push it, and you know, it was great for the businesses that I work with where people were in weird rural areas and it would be hard for them to get to the doctor. But now it's a thing. I mean, everyone wants it. You know, when I actually, a couple people, I was like, oh, they were like, I need to go to the doctor. And I'm like, are you going to the doctor? And they're like, no.
I'm sitting in my bedroom.
Right. So, and it's fascinating, but, you know, remember, besides the telemedicine, although you want to make sure people know how to access that, you can substitute those gym memberships and those commuter benefits with mental health coverage, stress management programs, financial wellness, childcare. And if you look at this graph, these are just some of the ways that employers are looking to kind of replace some of those things that are no longer available to their employees. And, you know, quite frankly, some of these things might be less expensive than the ones you were paying for the gym, etc.
Right. Yeah, and some of these things can be packaged together. I mean, they actually paying out for things like financial assistance and food subsidies is one thing, but having a program like an EAP, which is an employee assistance program, that allows people access to mental health workers and to financial counselors, financial assistance counselors, and legal counselors. These are all things that, you know, people don't know they need them until they need them. And right now, you know, in worst case scenario, if somebody's family member gets sick with COVID, and now they're dealing with the stress of that, they're dealing with possibly that person not working, and so there's a financial issue around that. What if that person passes away and now they have to deal with legal ramifications from that, and anything that comes up with that? These are things that for a very small amount, the company can support the employee through something like an EAP and give that access in these, you know, this urgent need that the employees have.
And I'll give you an example. So the other day, Sarah was talking to us about budgeting for next year, and she said, would you like a second screen? So most of us work on a laptop, some of us also on a desktop, but most of us have one screen. There's just a small group of us. But when she offered that, I mean, before she could even finish what she was saying, we were like, yes, I want it. Great, please. And so it's those little things. Well, granted, I know that can be sort of expensive, but if you were to offer that as a benefit, think of how huge that would be right now. If you had offered it as a benefit last year, maybe.
Yeah, because things are changing. I mean, in that example, that was something where people were working on their laptops a little bit, but it wasn't all the time. Now we are on our laptops constantly, and we have to readjust how we're doing our work. And it's looking outside of what was normal, or looking at what has changed, and because of what has changed, what are the things that are not available anymore, and how can you add those things in? How can you make a band-aid or make something that would complement the situation in a different way?
Come on, go. Okay, so just real quick, going over the basics. Make sure right now, if you have a 1/1 plan year start date, get the forms. And I've seen carriers really lag on this, especially if they have a lot of clients or you are making a lot of changes. But, you know, they may not be able to get this to you in a reasonable amount of time. So make sure you're very clear with them about the timeline for those documents, because your employees are going to ask you for them, whether it's, you know, a hard copy or an online benefits enrollment system. Again, with the benefits enrollment system, you're still going to have to tell it what the benefits are for them to be able to enroll. You've got to tell everyone it's coming. If we've learned anything at all, it's that no one is going to remember that it's open enrollment. That's impossible.
Right.
And I could send 80 emails and it probably wouldn't work. So start right now. And you can use the trick that I use, which is I send an email about open enrollment, and then I hit enter, and then the bottom I say, if you can read this, then you've won a free lunch from Chipotle. And guess what?
No, nobody responds.
So sad. But yes, so see if you can at least let them know. We'll talk more about communicating to your employees. Make sure that there's a package with the information. If you have a benefits guide, that would be great. If you don't have one, check with your broker. See if they can just make you even a one-pager so that employees can just quickly take a look at that. And remember to be firm on deadlines and make sure that you are on top of things, to make sure that everyone's doing things on time. And there's no harm in kicking off open enrollment early. I mean, I definitely have had companies that start it now. I remember doing open enrollment meetings on Halloween before. So it doesn't hurt anything unless, again, you don't have the information yet.
Right. And kind of as a side note, but you briefly mentioned your broker, and our target market, our target audience for this is really small businesses. So businesses with 50 or less employees.
Mm-hmm.
And the brokers that work with those type of clients, and this we're talking benefit insurance brokers specifically, vary in what they offer to those clients.
Mm-hmm.
Sometimes they offer very robust packages. They might offer to pay for a program like Ease or Maxwell Health, which are online programs that you can use. There's some brokers that actually will pay if you're using a system like Rippling. They may pay for the broker side of Rippling, which means you can automate all of this information. But from there, it all has to be done. Generally, it has to be done manually. It has to, the employee can fill out the form, but somebody has to get it from the form into the system. And it's really important to know who's taking responsibility for that. And some brokers will do all of that for you, and some brokers won't. And so, and if you're interested, you can reach out. I have a list of brokers who will, and I have a list of brokers who won't. But it's important to know that, because the reason we're doing this program for you today is because we want you to know what the responsibilities are in case the broker you're working with drops the ball or is not as proactive about things with open enrollment as they could be. Because ultimately, you are the employer, and it's your responsibility to make sure that the employees get this information and they have all the information they need. And so making sure that you know what the enrollment forms are and that you learn about the coverage. We're telling you this because these are questions you should be asking your broker, and you should be getting this information from your broker. And if you're not, ask them about it. Find out why you're not getting it, and find out where they think their responsibility ends and where your responsibility begins. Get off my soapbox now.
Oh, no, I would have said the same thing. So we can't get everyone in a room. Like usually it's like, oh, it's open enrollment and I'm going to hold a lunch and learn, and we're going in the conference room. So most likely for most of you, that's not possible. So you need to be a little creative in how you want to do open enrollment this year. So one example that we have is something called the Virtual Benefits Fair. Not sure that though any of you have held one before, but it's basically a chance for employees to learn a little bit about each of their benefits, whether it's in person and you have a representative from each of those benefits there, or in this case, you have information about the benefits from the carriers so that they can go in and just start looking around and they can start asking their questions now. So you want to figure out what would your employees want to know about, again, medical insurance is going to be huge. You could even have a whole separate section of click here for COVID so you can see your coverage. And think about how would it be successful? Is it a good idea to have a virtual benefits fair as we are going through? Or, how will you know that it worked, basically? So you're just trying to imagine that, okay, it used to be a table with this Kaiser representative here and a table with the John Hancock representative there. So you're trying to just bring it home. And this could be anything from, let's say I go online and I'm really interested in mindfulness. It's not necessarily that you're offering that benefit, but you're offering the benefit in the benefit fair. So they can click on it and download Calm, or they can click on fitness classes and download an app for that. Cooking demos. These are all examples of things that they can do during this virtual fair. And they can go in whenever they want, 11 o'clock at night. I mean, it's all there. You don't have to set up a time for everyone to meet.
They can also set up time. You can coordinate with the different carriers and have somebody available where they can actually set up a time to talk to them. So if they want to talk to somebody, if you offer Kaiser as a benefit and they want to talk to somebody from Kaiser specifically about what the benefit options are, what the differences are, what's the best option for them, then they can talk to somebody directly from Kaiser. Because you don't want to know about their health history. That gets into protected health information, private health information. You don't want to cross that line. And so having somebody that you can have them speak to directly, and they can make the appointment, they can call from home, they can do all of this information and gather the right information from them, gives them that flexibility to figure out what's best for them.
Yeah, and if you get any pushback, you can remind them that they used to have to drive out to your facility and sit there and wait for people to come to them. And they have it really easy this year, in my opinion. So don't let them push back on that one.
Yep.
Again, we want it to be as convenient as possible. People working from home, some of them have strict work hours, but that doesn't mean that they have to check out open enrollment during that time. This is a time where they can check it out whenever is most convenient for them and on their own schedule, which I know we just talked about.
And they can also do it when they have their spouse with them, their partner with them, or
oh, that's right.
If they need to, if it's somebody who's not comfortable talking about health information that confuses them, they could have somebody with them that they feel comfortable can help to explain that. I mean, and it's not always a language barrier. Sometimes people just get freaked out when you're talking about and get very confused when you're talking about health benefits. And so it's important that they understand what those options are. So
yes, thank you for mentioning that. I've worked at companies that actually said it's a waste of my time to go to open enrollment, so my significant other is going to go,
right,
because they know this stuff and I don't. So this eliminates that. This gives them a chance to say, here, you do it, you take a look at it. If you have one person in your household that knows more about that than others.
Right.
So we're going to show you a sample virtual benefits fair, and I'm going to switch so that Sarah can show her screen. I just wanted to give you a visual of what we're talking about here. So this is the University of Houston, and this is their virtual fair. It gives the dates. They have a different plan here, obviously. Oh, if you scroll up just for a second, Sarah, you'll see, first of all, they have an incentive. Oh, a little bit more down. Click here and be entered to win a prize. So you're giving them an incentive because they're not going to be in the drawing if they don't click on that. And it can be something real basic. It doesn't have to be a lot, but it kind of just helps that interactivity. And you can also go farther and say, okay, if you go to the videos and you answer these 3 questions, then you will be entered to win a prize. And so what they did was actually ask their vendors for presentations. These are not live webinars. These are videos that they received from the vendors that they put here, which I think is just a super idea. If you can't do that, you can make your own video, of course. And so what they did was also create a calendar for live sessions. So again, as Sarah was saying, a time in which they, your broker or carrier or whomever has set aside to talk to folks. You could either have them sit on a webinar for an hour and kind of people go in and out, or you can have a calendar that people can sign up for. That way, the person who is part of the fair, it's based on their calendar. They'll set it up the way that works best for them. And then basically this last part, these are all the summary plan descriptions. You click on it, you get the forms, anything additional that you would want. They actually have, an extensive amount of resources here. And guess what? If you put them here, they don't email you and ask you for them, and you don't have to forward it to them. So to me, it's a very big benefit. And granted, I wanted to show this benefit fair in particular, because even if you didn't have the video presentations, I think that you could probably put something like this together on your website. Great. Okay, so we're going to talk about just some general tips. Again, these are general from what we've learned over time as folks who have been involved in open enrollment for a long time. Emailing and texting, we're going to show you an example of a cheat sheet, FAQs, and then a virtual office hours, which we've kind of already went over. So one thing that I've noticed, especially now, is a lot of folks may not have access to email. So they might be out and about. By now, I mean, a lot of the small businesses we have, for example, maybe they're a landscaping company, maybe they're an interior design company. And if I were to send Bob an email, he's not going to see it until 6 p.m. at night. And a lot of our small businesses don't have email addresses for all their employees. So there's nothing wrong with sending a text. If wherever they are, they have their phone with them. That's so true. If you want them to see something quickly, just send the text and send out like, hey, it's open enrollment. Do I know how to send out a group text? No, but I bet you I could figure it out.
Well, and I think even if you're not doing it, because maybe you don't want to do it from your phone, there's a lot of different services out there. I mean, when we go to the HR conferences, they have companies that specifically set up things for texting out to your employees and gathering information. But I actually just sat in on a conversation about an email marketing system called Active Campaign, and they allow you to send out email alerts. And as we're talking through this, I'm like, well, why couldn't you? I mean, I'm sure that Active Campaign is not the only email marketing company to do this. And most businesses have some type of email marketing campaign program. If that's an option, then you could actually have a segment of your list that is your employees and be able to either text or email or do something like that. So you don't have to buy a system that's specifically for texting out. You could do it like Suzanne said and just sit and text people individually, or you could utilize another system that maybe has that capability. But again, we have to think differently. We can't think about it in this narrow, telescoping kind of way. We have to look at what programs we have on hand and see how we might be able to use them differently.
So this is just an example of a cheat sheet. It's a little bit small on the presentation, so I'm going to ask Sarah to share her version with you. But what do we mean by a cheat sheet are the super FAQs. So first and foremost, well, they didn't put this on top, but I would put the dates. And then what should they know? What are the basic things? We're adding blah, blah. We are not having vision anymore. I mean, whether it's good or bad, they just want to know the changes.
What's changing? What is different from December 31st to January 1st on my benefits?
And granted, they might not know about the plans yet, but at the very least, they want to see the changes. If you are not making any changes, then say so that they know that. In this cheat sheet, they had a link to their virtual benefits resource. You can refer to your internet or your intranet. This was a very cool thing where they had a tool that you could click on to try to help you figure out what the best plan for you would be. And those are pretty cool. I have not used one myself. I know that there are companies that are doing that more and more, which would help us out greatly, because I'm not supposed to give someone advice on what plan they're supposed to choose. But if they could do it themselves, that would be great.
Right.
And
one thing I'm sorry, Suzanne, one thing to keep in mind with the URLs is making sure that you have a URL that you actually put the URL. Like, this was great if somebody's looking at this on a computer, but again, if somebody doesn't have a computer or they print it out and they're just not comfortable with that, make sure that the URL is listed there. And if possible, use something like Bitly or Rebrandly to make a shorter URL. You don't want a URL that has, XYW34, something as the link. Make it easy for people to be able to at least type the link out, if not remember it.
But again, if I received this as a text and opened it and clicked on the link, they're gonna go to the site.
Right.
So that's exactly what you want them to do. Make it as easy as possible.
Yep.
And then at the end, they just have, the link to the platform to enroll in your benefits. And if you look right here, this is also a huge one. This says in this example, your benefit elections won't carry over. So some people have passive enrollment, some people have active enrollment. So some companies say, I want you to reelect everything. So no, if you've chosen Kaiser Blue this year, you don't get it next year unless you enroll. Others prefer to, especially maybe now that there's not as many changes that will be made, they prefer to say, if you are enrolled in Kaiser Blue and you want to stick with Kaiser Blue, you don't have to do anything. And so you want to think about which would be better for you. There's pros and cons to both, really. You want to make sure people are very aware of what they have now, what they might want. And it's tricky when you have a very active enrollment. You're going to have to chase after more people to say, I know you have benefits today, but you're not going to have them on January 1st unless you do this.
Great.
Okay. Oh, I'm switching. There you go. So we've talked a little bit about frequently asked questions. Again, I would put these on a cheat sheet. I would put them maybe in a text. You could do a separate text. When is it, but what is it? A lot of people don't know what open enrollment is. It's very simply a time of year that you can make changes to your benefits without experiencing some type of major life event. That's what it is. So you can remind folks, you could have another chance to make changes, but if nothing happens to you, you'll have to wait until the next open enrollment. And I've seen this time and time again. Folks do not know when the plan year begins. Even the calendar year plan years, they don't know when it begins. So one thing you want to make very clear is if they are getting new cards in the mail, if they have to kind of get rid of their old cards and use this other one, or maybe there's a new plan number, because it never fails. I have people who make appointments to go to see the dentist on January 2nd. And
Yep.
it's like people, you can't give me like a couple days to make sure everything is good to go. And they're like, my card doesn't work, it's not in the system. And it's important for them to remember the timing.
Unfortunately, those are the same people who don't
Don't read
enroll
my
until the
emails.
very last day. So
For sure.
watch out for those people. When those people enroll on the very last day, find out when they booked that doctor's appointment for, because you know the only reason they enrolled is because they booked a doctor's appointment. And it's probably
Yes.
coming up soon.
Yes. We talked about make sure they know what changes are being made. Also tell them if no changes are being made. And we're going to assume a frequently asked question is about mental health. I'm going to assume that a frequently asked question is going to be about COVID. Those are new. We've not had those as a frequently asked question before, but be prepared that that will be frequently asked this year. This is a long slide, but it's just a fancy way of saying, one thing I've learned from just being a consultant and needing some more efficient tools, I've learned how to use other systems to communicate in different formats, maybe, and you get so bogged down and like, okay, I'm going to send my emails and that's what we're going to do. And why not have a quiz? Why not have a poll? Do a short video, do an graphic. These things, again, help engage people in open enrollment, and they would like to know what you have to offer, which is the whole point of having benefits in the first place. You want to make sure your employees know the benefits so that they can feel good about them, and not that they didn't know about them because you were working very hard to make sure they do have benefits.
And when you're talking about these different things, this could be something as simple as, doing something in PowerPoint or presentation if you're an Apple person or a Mac person.
Yeah.
But there's also so many free tools now. We were talking about Canva at the beginning of this presentation, and there's a free version of Canva. You can go in, you can make really professional looking infographics and presentations. You can add action to it. You can do all types of things. In terms of quizzes, there's a lot. Gamification is a huge thing right now out in the world, and so doing things where you're actually creating quizzes and creating polls and getting that interaction, because when somebody's just speaking at you for an hour, as we have been, it can sometimes be a little, it can get a little lost in your head. It's like, well, what did they talk about? But when you're taking a quiz, when you're taking a poll about something, you're interacting, and now you've got more senses involved, and so you're more likely to remember that. Doing videos, there's things like StreamYard is one that you can create online videos and post it. You can either do it live or you can store it and upload it to your website or upload it to a document. So these are things that are free and available without going out and getting a professional videographer or
a
doing
monthly
anything.
plan, or
I mean, you can choose to go whole hog, or you can choose to like get something out in half an hour, like write a script and do a short video. It doesn't have to be special, but it doesn't have to be fancy, but it can be special in that you're still creating something that's different so that the people are going to remember it a little bit more.
And remember, visualize it. So someone can't pop into your office and ask you a question. You can't go over and pop in and see if they have a question. You don't have a break room where there's things posted. Those are all gone. So you have to replace them with another way to communicate with your employees. So overall, we just want to kind of go through a quick summary, but I hope that those of you who have watched have learned just a little something, if nothing else, to just think outside the box a little bit. If you do open enrollment as normal this year, I don't know that it's going to be very successful for you. So what will make it successful? Think about the COVID pandemic. How is that going to impact your benefits open enrollment? Is there something that could prevent my employees from taking action? Again, because they're not physically there or because they can't get online on time. What do you need to do differently than last year? And what else could I give them to make it successful so that they feel like, yes, I went online or I submitted this. I know exactly what my benefits are. And I feel confident. I feel secure in my benefits for next year.
Yep.
Great. So I appreciate everyone. If you have any questions, this is a great time to enter them in the Q&A. And we really have enjoyed our time with you guys, and hopefully you have some new ideas.
Jenny,
Thank
we have any
you.
questions?
Yes, thank you, Sarah and Suzanne. That was very informative. We do have a couple of questions that have come in. And this, you mentioned this and you had talked about this earlier. For those employees who cannot attend a virtual fair, be it that they don't have access to a computer or a phone, whatever it is, how would you recommend offering the benefit enrollment information?
So I think for them, you really have to meet them where they're at. So making sure that they have access to somebody who they can get on the phone with somebody, making sure, if you're in a situation where you can meet face to face in a safe way, making sure that they can set something up. But it really, this is so important. And it's something that is so often kind of overlooked anyway. But now with COVID, it's really important that people understand what their benefits are and get those questions answered. And so to be able to get on the phone with somebody, especially if, maybe they aren't comfortable with English as their first language. And so being able to have a translator with them, being able to have their partner with them to help answer questions, but making sure that there is time set aside outside of just business hours that people can, make a phone call, schedule a time, and get those questions answered, I think is really important.
Great. And last question, this is a very quick one. A participant asked, is participating in a virtual benefit fair considered paid time?
Oh, that's a great question. And for me, I would pay it because even though it's technically not mandatory, I want someone to take the time to look at their benefits. And the last thing that I would want is for someone who sits through it for an hour one evening on their own time when I'm trying to talk to them about my company's benefits. So I think that's another incentive as well, to make sure that your folks know when you go into the virtual benefit fair, it doesn't matter what time, just make sure you're keeping track of your time because that is paid time. I usually err on that side because if I tell folks it's not, then they're very much less likely to actually go to the virtual fair.
Yeah. And so to Suzanne's point, it's if you're requiring people to go, then it's like any other meeting you're requiring them to go to. So it would be paid time for an hourly employee, for a non-exempt employee.
Right.
But I would agree with Suzanne. To encourage people to participate. I mean, the thing is that if you were having those meetings during a regular business hour or business hours, then you would be paying them for that time anyway. So I would encourage you to have people, maybe you would give them an allotment of time. Say, you can lock in for up to an hour of time, whatever would be equivalent to what
That's a good idea.
What you would have had when you were working in person. But yeah, making sure that they feel like this isn't a burden to them, that they are going to get an extra hour out of this, I think would be great.
Fantastic. And that wraps up our Q&A for our day today. So,
all right.
Thanks, everyone.
Thank you so much for joining us. We'll see you next time.